Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. In this episode of the podcast, we're connecting with South Riverdale Community Health Centre in Toronto. We'll explore some of their experiences during the COVID-19 pandemic, including how it has impacted their efforts to address another pandemic that was already here before COVID-19, the crisis of tainted drug supply and overdoses. South Riverdale Community Health Centre provides a wide range of primary care, social, and community services in the East End of Toronto. You can learn more about them online and access links to their social media platforms at www.srchc.ca. Today, I'm speaking with Rhiannon Thomas, South Riverdale CHC's Program Coordinator for Counterfeit Harm Reduction Program, and Sarah Greig, the Program Manager for Moss Park Consumption and Treatment Services, also at South Riverdale Community Health Centre. How are you both today?
Good, thanks. How are you?
Wonderful. I'll start off, Rhiannon, by asking you to tell me a bit more about South Riverdale Community Health Centre, the main aspects of the organization, the community you serve, and the services and programs that you provide.
So South Riverdale Community Health Centre has been around for, I think, 42 years, 43 years. And we provide a wide range of health services, so anything from primary care, diabetes care, there's chiropody, and then kind of more the work that we do, which is, providing harm reduction, variety of harm reduction services and supports to East Downtown Toronto, East York, and West Scarborough.
That's perfect. Sarah, did you have anything else that you wanted to add about the wonderful work you guys are doing there?
Well, I'll just say that my work is it's part of that harm reduction spectrum of services that we offer, and the work that I do is in the Moss Park community located at Queen and Sherbourne. And we do a variety of harm reduction supports here, and mainly an injection service, so people can come in and use drugs under supervision of folks that can help them if they experience an overdose.
Rhiannon, did you also want to explain what counterfeit is as well for any listeners who don't know?
Sure. So what counterfeit does is kind of all the harm reduction stuff that isn't consumption, supervised consumption, or safe supply. So we have our primary kind of hub at 955 Queen, and that's where we do needle, syringe, harm reduction supply distribution. Before COVID, that's where we had a lot of group programs, including, gender-specific programming, and a lot of kind of groups to encourage, to reduce social isolation. But we also provide a bunch of kind of services like outreach. We have mobile delivery. We have people in the community who distribute harm reduction supplies kind of privately. And we also operate a hub in the Oak Ridge neighborhood, and are working on kind of expanding those basic harm reduction distribution services throughout the East End, where there's very little service available.
So as you just described, many clients you serve are already dealing with the challenges related to substance use, lack of safe supply, and overdose, and then COVID-19 hit. How has the pandemic changed what you're experiencing in the community on those fronts specifically? How has it affected your efforts to get various harm reduction services and support to the folks who need them? Sarah, we'll start with
you. I'd say, in short, it's been a nightmare, an absolute nightmare. The pandemic has, the COVID pandemic has made us change the way that we work with people, and especially initially, there was a lot of medicalization of our services, which actually creates like an additional barrier to folks coming in. We had to distance more intentionally. And when you're responding to overdoses, that's not what we do. We don't stay distant. We get right in, right? Like we have to get really, really close with people. So there was additional barriers that were created for us. And, we had to wear our new PPE, and we tried kind of these plastic tents for a while so that if people were overdosing, we had to zip ourselves inside of them. And it was terrible for people. Like, it was really, really hard to connect with people. It was hard to offer service to people in a good way. And in addition to that, the entire city shut down its doors to anyone who was living unhoused. So that meant that people had lack of access to basics, services and supplies, and people couldn't even go in and sit down and get warm or have a coffee anywhere or use a toilet anywhere. So it really changed our world in a super negative way. And then folks were relocated from communities, like tented communities that they were living in, and taken outside of the neighborhoods, right? And taken outside of their community of people who would, who we would look after, right? We would look after each other. So then we we just weren't able to do it all. And a lot of people started smoking their drugs instead of injecting their drugs. And, there was a lot of overdoses occurring outside. And actually, the COVID pandemic has made us all into really brilliant sprinters and runners, because people come and bang on our door when there's overdoses. And at least once a day, we are running as fast as we can to get to someone to keep them alive. So it's not just the overdoses inside and with all these additional barriers, but it's the overdoses outside that's really impacted people. And it's really similar, I would say, to a war zone when you come across like just dead bodies everywhere. And there's many staff and community members who have unfortunately found people who we care about, in the community who've passed away in really undignified ways, and it's been a heartbreak, and it's been a nightmare over and over again. And we're still going, actually, which is crazy to me, but we're still at it.
Rhiannon, did you want to add anything?
Yeah, I would just also add that even before the pandemic, the people that we serve in our harm reduction programs were already living in deep poverty and, lots of isolation, poor access to housing, and even folks who have been housed, have food insecurity and all those things. And then the pandemic just kind of made it all worse, for the reasons that Sarah said. And I think kind of now at this point, after, pushing 2 years, we're really seeing the impacts of, 2 worse years of isolation on people's mental health. And, sometimes people ask, what are the highlights of your program this year? You know what? Staff showed up for work. People came to work every day to keep helping people.
I think you both touched briefly on the next point that I wanted to say, and it's honestly what touched me the most when I went down to South Riverdale on International Overdose Awareness Day, and saw how deeply affected all of the staff was by these losses. And I think to a normal person who has the privilege of not knowing about these barriers, you wouldn't get to see that, how much it affects the people who work at community health centers on a daily basis. These are literally life and death supports for some of your clients. And I know that, as we just described, it must take a toll on all of the team members as well. I'm just wondering if you can touch on the supporting care and the support staff at community health centers and how you're able to work through these very difficult multiple pandemics that you guys are experiencing.
I'm not sure where to start there. I think on the one hand, for years in harm reduction, it was sort of about keeping people alive, but trying to make people's lives better. And I feel like now what we're doing is just trying to keep people alive, and we can't even do that. Yeah.
And I would go so far as to say that we are not well. I'm not well. We're not well. This is hard work, and we haven't figured out a good way to care for, like, we're in survival mode right now, right? So we haven't figured out a really great way to care for our staff and our communities and ourselves. I don't know how to do that yet. right? So I would say that day to day, we're all just doing the best that we can. And sometimes the best that you can do is just show up and, breathe in and out and say hello to someone. And it's devastating. Like there are weeks that we lose 6, half a dozen people a week. Like you can't prepare for that. You can't. Self-care doesn't fix that. A bubble bath doesn't fix that, And, it also, it's a time when it's like, even mental health supports, it may not be actually the time to dig deep, because it's like once you open up that wound, we're not going to stop bleeding. So we need to have that time and space and that emotional availability to actually process it. And I actually think it would be not a great move to try to process that when we're in the middle of it, right? It's almost like we have to keep on going, get to the other end of these pandemics before we can kind of take a breath and reflect on what's actually happened and how our people and our communities have been slaughtered, right? Because that's what's happening. It's like there's people who you never thought would go, they're going, right? So yeah, I don't know if I've answered your question, but I would say that we're not well, and we're just doing the best that we can kind of day to day.
I would just add to that picture by saying, the work that is happening in the consumption services and in the frontline harm reduction. If you think about a community health center and what that looks like, there's various floors and there's rooms and there's people in offices doing work. The people who work in our programs are on the street. They are the first people that people see when they come in to whatever location they're coming into. There's no filter. It's like people come in off the streets and whatever people need. Or we go out in the streets. We're literally outside when people can't get in anywhere else, when they have are screened out of everywhere. The work that we're doing is there.
No doubt that it's amazing work, and I can't imagine how difficult and traumatizing it must be to experience that on a daily basis. What additional supports do you think would be beneficial and that you'd like to see from federal, provincial, and municipal decision makers?
I want to let Rhiannon answer that one, but just to tap on, I think the one thing that we actually need to do is we need to change our language. We need to change the language and how we talk about people, and then also we need to change the language around the work. It's like, and you said it, yeah, there's a lot of trauma in the work, and the trauma that we're experiencing is not vicarious, right? We have a whole team of workers who are experiencing primary trauma from the workplace, right? So it's actually like these dual pandemics are also like the side effect to that is actually a ton of workers, and not even just in our sector, also in like the shelter, support, and homeless sector, right? Like there are so many people who are impacted firsthand by what's happening, and by the number of overdose deaths. And that's a thing that we're actually, I feel like we need to gear up for it. We need to be prepared for it, because soon there's going to be workers who aren't able to work anymore. And it's not through vicarious trauma or compassion fatigue. This is because of like primary, firsthand, complex trauma day in, day out. So I think the one thing I would say is that what, various levels of government need to do is you need to prepare for that, right? Because emergency responders have some supports, they have some systems in place, with, because it's predictable, and, like things like, paramedics and policing, it's predictable that people would be traumatized at work. And I don't know that that's always been a prediction for harm reduction work explicitly. So I think we need to prepare for that.
Rhiannon, did you want to go ahead and answer as well?
Yeah, I mean, I think the only thing I would add is I feel that at South Riverdale, we're very lucky in terms of harm reduction. We, are funded to provide a lot of supports, and not everywhere that does harm reduction work has that kind of support and has kind of management support. So, I want to be very careful about that and really recognize that, the programs that we have, have a long history of doing really good work, but also, having support to do that. But if we took a step back on a kind of bigger scale, these kinds of services are they're proven to be effective. They're very efficient. They probably, we do need to invest more in, as Sarah said, the kind of supports that other frontline first responders also get. But I think just generally, these kind of services need to be kind of more embedded and more available. We're sitting here talking in Canada, or sorry, we're talking in Toronto right now. So, the center of the universe in Canada, in Ontario, that has all these other resources. And, tons of places in Ontario don't even have access to needle exchange, much less consumption services. And then when you look at the rest of Canada, I speak to colleagues across the country, and they don't have drug checking. They're waiting on public health units to get needles. This is really basic stuff that is required. And I think in general, we need to really look at how resources are distributed in our country and in our cities, and think about what's the best use of resources. Do we want to be investing lots of money in militarizing police forces, or should we be looking at investing in housing and basic income supports, things like that?
I'd also say another thing is around like making those community specific too, because Rhiannon's right. Like we're very lucky at South Riverdale that we're part of a larger organization that cares about our people and cares about the work. And I know that's not the case in a lot of other communities, right? And that overdose isn't just happening in Toronto, it's happening all over. And yeah, there's some fundamental like kind of harm reduction services that could be implemented anywhere and should be implemented everywhere to help keep people alive.
What would the both of you say that your experiences at South Riverdale over the last 19 months say about the role of community health centers and their ability to adapt to emerging social and public health issues? Sarah, if you want to go first.
Yeah, I'm actually really proud of the work that the organization's done over the past, 19 months or however long it's been. Like I think that the organization did a good job at keeping, staff kind of healthcare at the forefront of decision making as well, and also people who use the harm reduction services as priority for access to COVID vaccinations, for example, and thinking of ways to go to community rather than expecting community to come into the center in order to receive care. So I think they did that really well. There was also additional supports, like in terms of food and gift cards and things that people could use to have access to basic needs. Outreach to encampments was done, like is still being done, and just finding those ways to meet community where they're at, right? We always have to do that. We always have to meet people where they're at, and also to include people in decision making. So like those are things I feel like we're done really, really well at South Riverdale.
Rhiannon?
Yeah, I don't have a lot to add to what Sarah said. Just I do think that having worked in a few, different kinds of community organizations, that a community health center does have the ability to pivot a little bit. And I think part of that is, the way that the centers are structured and funded kind of gives people the ability to, when something comes up, be able to change and think about how to do things a little bit better. And I think it's important to have that, because other health services are often much more rigid, and as a result, really serve the community in the same way.
The other thing I'd say that we did well too is just to leverage our partnerships, and it's possible that new partnerships were made too. just, like working with partners to help deliver services, and also the communication that was done around the pandemics, I feel like has been improving, and it did improve. Um, yeah, especially at the onset of COVID, there was like constant staff updates. And I feel like that's also something that's not done everywhere. And that's something that I really appreciate, is that there's always an update, even if there's not much to say.
If you wanted to learn more about South Riverdale Community Health Center and the work that they're doing, again, it's www.srchc.ca and sriverdalechc on Twitter. I want to thank both of you for your time today and having this conversation with me.
Thanks
so much for having us.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.